questions to 3 or fewer. If we have time in these 15 minutes, we will do a second round of questions. And again, for those who haven't done this before, please use the raise your hand feature. It can be found under the participants list, and we will unmute you one by one to answer your questions. But first, I think Commissioner Outlaw wanted to say a few words.
Thank you. I just wanted to say good morning and thank you to everyone who joined in on such short notice. I wanted to make myself available so anyone who had questions specifically for me could hear directly from me firsthand, because I've noticed lately that over the last few days that there have been a lot of PPD operational specific questions. So I'm making myself available to you to be able to take care of those questions and responses.
Thank you, Commissioner. We're going to start off with Matt Petrillo. Matt, go ahead.
Hey, good morning. Thanks for your time this morning. We've seen some officers wearing masks incorrectly, some not covering their nose, others touching the insides and outsides. I'm wondering, have officers been trained to properly wear those masks?
That's a really good question, and I'll take it a step back. So all of our officers have been issued N95s. We're really in conservation mode, which is why we put out guidelines on when to use them. It's a tiered approach, but then also how to use them as well. Recently, over the weekend, the city, through the Office of Emergency Management, had been working with some manufacturers here to produce something that would be a step down from the N95, but to offer some form of protection against each other. With that said, given that it happened all so quickly with those masks, I don't have a prototype of what the mask looks like. It's a very thin cloth mask. We pushed them out to dispatchers first, and then we started distributing them yesterday, and then the guidelines got pushed out after the fact. So, a lot of this stuff we're kind of doing on the fly as equipment avails itself or as new issues arise. The ideal situation is to be able to push out guidelines first and then disseminate or distribute the equipment. But, given what we've been dealing with, it hasn't always been perfect.
Okay, thank you. Second question, an officer told us the FOP provided him sanitizer. Does the police department not have enough to distribute?
So another very good question. The answer is yes and no. So we get our supplies through the city. All of the stockpile, all of the equipment that we get are distributed to each individual department. So what we're pulling from is also supplies for the rest of the city as well. So whether it's disinfectant, which we have disinfectant, we have hand sanitizer. But again, everything is in limited quality, and the FOP has been amazing with stepping up and helping us with filling in a lot of those gaps. I mean, people are really stepping in, seeing where the gaps are, seeing a need, and offering their assistance just as long as it gets done.
Thank you. And third and final question. We have been hearing from cities across the country. They are revealing the numbers of officers with COVID-19. In full transparency, we have 0 in quarantine at CBS 3, no positive colleagues on our staff. We are hoping to get the numbers for fire and police. And if you're not able to provide that, have you been speaking to the commanders and the officers? Many have reached out to us and explain why that's not happening. A lot of them said that they just feel in the dark. They're trying to piece this together themselves.
Yeah, and it's unfortunate that, again, we're working in very uncharted territory right now, and we do know that other major departments have released that information. It is the city's posture that they are not releasing numbers, so to speak, but internally, I can assure you that we track not only the number of positives, we track who's on quarantine, we track who's awaiting results. We do all of that to make sure, one, that folks are being taken care of. We do that to track our staffing levels, and we make sure that those who need to know at the leadership levels, including the union, are aware of what's going on so we can make sure that we get resources needed to where they need to go. So I understand wholeheartedly that it's tough when there's not and for certain types of information that's pushed out. But given that this is different, this is public health. We're not pushing out health information. This is not, for example, how many officers were caught, off duty doing something or whatever. It's very sensitive information. And it's a fine line and a very delicate balance with releasing information on a daily basis that could also lead to panic or people calling in sick because of fear and paranoia. I will share with you that, our numbers, fortunately, and I hope that it stays this way, are low enough to where I'm not concerned about a need to call for mutual aid or finding other ways to staff our traditionally filled positions. So that's very good. It's very, I would say it's uplifting for us in that sense, but I certainly understand the frustration that people feel. We do have protocols in place where we do contact those. There is contact tracing being done. If we believe that there's possible exposure, there is cleaning done immediately, and we do ask that folks that have been exposed or believe that they might have the virus that they quarantine. And again, all of that has been pushed out via protocol.
Okay, thank you, Matt. And we now go to Chris Palmer of the Inquirer.
Hi, Commissioner. Thank you. It was sort of a jump off the last question. It was mentioned yesterday that you were at least partially working at home. Have you been tested for the virus, and do you have it?
I have been tested, and I have tested negative. And I'm telling you that I share this because this is a personal decision. I will not be releasing information from anyone else. I will share with you that, one of the things that we found out very early on is that areas where there's either communal space in a facility like a gym or units that work very closely together, we found that the numbers there are higher than in other places of the department. I have instituted policy where we rotate our schedules, specifically with detectives, for example. And even here, we're not immune, pun intended. Here in the commissioner's circle or in my office, I have asked that all of our admin staff work from home as much as possible, and even amongst the leadership team, that we rotate our time in and out of these offices so we're not all here at the same time. So I am well, I am here, we're in and out, and we're doing the very best that we can to stagger our time in the same physical environment. And I'm asking that of not just leadership, but of everyone here that works for the department.
Just a quick follow-up on that. Do any of your deputies or interstaff, have any of them tested positive?
Not that I'm aware of. And again, there are, like I said, protocols in place for when that happens. Hopefully it does not. But when and if that happens, we will make sure that we take care of those folks just like we are anywhere else in the police department.
What, if anything, have you instructed your officers to do to enforce social distancing? We've heard reports of, for example, people playing basketball in parks or being close together in areas in ways that are not in line with what the mayor has instructed. What are you instructing police to do in those types of situations?
This goes back to basic common sense. And I might have answered this question. I don't remember if it was last week or the day before. Honestly, all the days are blending in together. But we need to pick our battles. And the question that I'm asking our leadership to raise, and I'm asking each and every officer to ask is it the best use of our resources? Do we really want to inject ourselves in a situation, or do we need to inject ourselves in a situation that could make things worse altogether? How effective is it if we get on the loudspeaker and tell people to leave? Does that cause a crowd to disperse? In a recent example that I can think of, if there is a more strategic way to shut down the basketball game, for example, in the future, then that's something that we'll do. A recent incident came to light where there was actually a basketball game that we believe was organized, and it was one of the parks that had not yet had the rims removed. So we've been in communication with the city, and that is prioritized as a park to have that rim removed. But again, we have to be creative in getting to yes and enforcing social distancing and making sure that we're not picking battles that we don't necessarily need to pick. But a lot of this stuff is case by case, and we'll continue to do it that way.
Okay, thank you, Chris. A reminder to everyone that the commissioner has very limited time and only one representative per media outlet. Next, we go to Maggie Kent of 6ABC.
Hi, good morning, Commissioner Outlaw. I just have one question that officers were concerned with about time used, whether it be sick time, vacation, or would any time off in relation to COVID-19, whether it be they are actually ill or need to self-quarantine, would that count against their days accrued, and in what way?
Right now, we are coding it as it's a very specific code. It's administrative, and we're tracking details alongside with that, so we can go back and vet all of that as need be. I would say right now, my biggest concern is folks being able to take care of themselves and spending the time that they need, and that should be the last thing on their minds. I want everyone to be well. I want them to feel comfortable with distancing if they need be, or if they need to. And again, we'll take care of folks when it comes time for that.
Okay. The next question is about sanitation of vehicles and offices. Has that been ramped up? And what kind of procedures are happening there?
It's been happening regularly, actually. Specifically, if we know that there is an area where there have been positives, we immediately go back and disinfect those spaces. When we transport someone, when we make arrests or whatever it is, the vehicles are clean. There are very clear guidelines with that. Public property has been great with sending contracted cleaners to come and clean our facilities on a regular basis. So I walked in this morning and, it was a very weird smell, but I knew something had been done and it was clean. So I'm appreciative of that.
Okay. And then the final question is a concern about the number of traffic officers testing positive within the traffic unit. And is there a certain plan for traffic headquarters?
So again, I won't confirm any specific units or divisions with positives because it's really easy from there to narrow down to the individual level. But I will tell you, anywhere where we see, like I mentioned earlier, where there is an opportunity for groups to be together, usually whether it's specialized units or whether it's detectives or even here in headquarters, that's where we're making sure we're trying to do our very best to enforce. But, we all want to work. We're doing our very best to enforce staggered shifts. We're doing our best to enforce social distancing and making sure that we're not all in the same facility at the same time. In addition to the equipment that's been handed out, the disinfectant, the cleaning, and the hand sanitizers.
Great, thank you, Maggie. And next we go to Max Marin of Billy Penn.
Hi, Commissioner, thank you for your time. The first question is about gun violence, and shootings are up in recent weeks and have continued throughout the pandemic. Do you have any updates on strategies that the department is pursuing at this time to curb the shootings?
Yeah, so, the world doesn't stop just because we have this overlay of this pandemic. You saw that a couple of weeks, again, I don't even know how long ago it was now, quite honestly, and having stability and having a deputy commissioner over operations to carry forward the strategy that's in my brain and can now be implemented and driven by a person, I think is helpful. It is very, very important that we not only communicate and share data with, but to strategize with our local, state, and federal partners. There's a lot of overlap across jurisdictions, whether it's with housing authorities, SEPTA, our universities there. Obviously, there has to be a lot of collaboration amongst how we charge cases and consequences. We've talked about this before, and then making sure that there's proportionate consequences once we make an arrest. We're continuing to make arrests, but communication is really, really firm and really being precise where we focus our efforts. So we've got a lot started underway already with that, and I'm hoping to be able to get ahead of a lot of this before the weather gets a lot nicer than what it has been.
Thank you. One more question. Could you address the concerns about working conditions at police radio and tell me whether the department has provided sufficient PPE to police radio workers?
Absolutely. So, our radio room, and I walked through there just as recently as last week, it's not an ideal situation. And ideally, for me, in a perfect world, I would have been able to pick all of them up, move them to a completely different place, get them all new equipment and have them work remotely and do whatever. But that's just not the reality of what we are able to do in the time that we have. We have one person per console. We've created distance in between each console so they're not sitting as close to each other as they usually do. Again, disinfectant provided, hand sanitizer provided, and they were the first group of people that came to mind when we got these makeshift masks. They were given N95s some time ago, but that's really not feasible when you're trying to communicate with someone over the air, whether you're a call taker or you're a dispatcher. So, these cloth masks are in, I have one right here now. These cloth masks are something in between. They're intended to protect someone else. So I'm basically preventing anything from coming out of my mouth when I am either unable to socially distance or I'm in close proximity of someone. It doesn't necessarily protect me from what someone else is spewing off. But with that said, the dispatchers were the first to get these. And until we can get more surgical masks or that next level mask in between this and an N95, this is the best bet. But we're doing everything that we can to maintain communication with the shop stewards, which we are, and to really limit the number of people that are there, making sure that people take their breaks off the floor and in various portions of the facilities. But again, it's not ideal, and we are working with what we have.
How many people are working in the same room there?
How many people are what? I'm sorry?
Are working in the same room
What
at
were
one
your
time?
At any given time, it could be up to 43, and that number can be that high if there are trainees on the floor as well. And we made the decision, and this could change at any given time, we made the decision to continue on with our trainees in the event we need to replenish our radio room staff. Similar decisions had to be made about the academy. We had to put social distancing guidelines in place there. We made our academy classes a lot smaller, broke them out into different clusters, making sure that their interactions aren't necessarily the same. This is tough for everybody. Everything that we're doing now is completely counterintuitive to what we're trained to do. We're trained for close quarter contact. We're trained, and just as basic human beings, personally and professionally, everything that we do is either in a relational way or a close quarter interactional way with humans. And what we're doing now, and a lot of these policies, these protocols are being pushed out on the fly. It's the exact opposite of that. It's creating distance. We're talking about engaging community and including community, but now we're trying to find ways to do that virtually or with distance. So it's very challenging when you talk about organizational change. Usually we're talking about enforcing policies that have been in place and changing those policies that have been in place for years and years and years. Now we're coming up with protocols. It can be one thing at 10 o'clock in the morning, and then based on whether equipment that was there or is no longer there, it can completely change how we do something by 5 o'clock that evening. So frustrations can be high. The tension is high. There's a lot of uncertainty. And I absolutely acknowledge that because we are living in a constant state of flux right now. But we're doing absolutely everything that we can to make sure that not only our membership is safe, but we continue as best we can with our operations to ensure community safety as well.
All right, thank you, Max. Commissioner, I know you're out of time. We have two reporters who have their hands raised. Okay, great. Jack Tomzik of Metro, you're up.
Yes, I wanted to ask, last month at the press conference, you spoke about the changes to the arresting procedure. Have there been any further changes to that process?
No, there hasn't.
Okay, and then one more question. I know you said you haven't gotten to the point where you've had to call for mutual aid, but has the positive cases or quarantine affected the deployment levels? Are there less officers on the street than there normally would be?
No, we're actually pretty good. And quite honestly, when you look at the number of people that we have, I mean, it's less than, and again, when you remember quarantine is, 14 days max. So you have people that are out and then you have people that are coming back in. And the number of positives that we have and the number of positives that we have out are so low compared to the overall staffing numbers that we have. The percentage overall is extremely low. But given that we're constantly in a state of planning and it's contingency planning, we're aware of what our minimum staffing levels would be, and we know in advance when we would need to push that button. So no, I don't have any concerns at this time. It's an extremely low percentage right now of people that we have out. I would even say it's for sure less than 1%. It's not even 0.5%.
All right, thank you.
You're welcome.
All right. Thank you, Jack. And finally, Kristen Johansson of KYW.
Hi, Commissioner. Thank you. I wanted to see, do you guys have a policy in place if there were to be too many police officers who called out sick for either reasons that they may be sick or maybe they're fearful of coming in?
I'm not really clear on your question. People have the right to call out sick.
Right. I'm asking if there's a policy in place or policy that you guys have come up with if deployment levels, for example, become too low.
Well, that's a decision. Again, everything can't be in black and white. A lot of these things are going to be decisions on the fly. But these are numbers that we're watching. And again, I am aware of what we determine our minimum staffing levels to be. And if at any given time we see us approaching those numbers, that's when we have the conversation when we need to press that button for mutual aid. So the other part that I haven't mentioned is that I'm part of the Unified Command Group, and we meet every day, literally 7 days a week, and we stay in constant communication. And if there is a need for me to say, you know what, I need to get resources from other agencies, wherever those resources come from or what those resources may be, I have a very clear line of communication through the Unified Command Group to make that ask. So again, it's not necessarily black and white. There's no hard, okay, if we hit this level, this is when we push the button. And a lot of this stuff is we're learning as we go. The good news is that we've learned a lot of lessons. We're tracking what those lessons are, and hopefully this never happens again. But if it does, we are very clear in making sure we either repeat all of the things that worked really well, or we don't repeat what didn't work too well.
I just have one more question. With the, I know you had said that you talked about this at a prior press conference, but with anybody who may be taken into custody, whether for questioning or other means, do you have masks, or is there a protocol in place for people that interact closely with, whether it's people being interviewed as witnesses or as suspects or prisoners?
Yes.
Do they get masks? Okay.
Yes.
Can you just take me through a little bit of that policy?
Sure. And I'm hoping, fingers crossed, I can't make any promises, but all of the COVID-19 related policies or protocols that we've enacted, I'm hoping by the end of the day, I can have posted on our website, since I realize there's a lot of questions around that. There's nothing to hide there. But again, it's a tiered approach. We encourage social distancing when we respond to calls. If calls can be handled outside, we're asking that people do that. If they have to make an arrest or go hands-on, or if they cannot utilize a 6-foot distancing rule, we do ask that they put on the equipment that's given to them. Absolutely, when making an arrest, when processing prisoners, they're in full PPE. The only issue is that and the reason why we had to make it a tiered approach that way is because we just don't have equipment like talking about it, and we have to be very smart with how we use it.
Thank you so much.
Thank you, Kristen. We are way past the commissioner's deadline, but I see Jeff Cole, who's usually first. Jeff, I think the commissioner can squeeze in one question from you, so why don't you go ahead?
Let me go real quickly. Commissioner, we've got 362 officers evaluated, tested, or quarantined, 62 to 68 positive. Can you speak to those numbers, please?
I've already addressed that I'm not confirming numbers, and I explained why. And I've also, I think, very clearly explained that we have very clear protocols in place with how to deal with that. The number of people out right now, and again, these numbers will rotate as people hit off and then return to work. the number right now, or the percentage of people that are out, are not concerning enough to where we need to do anything as far as calling mutual aid or seeking outside assistance from the department.
Great. Thank you, everyone. And thank you, Commissioner. We will resume our regular 1 p.m. Briefing with the mayor, the health commissioner, and the managing director at 1 p.m. today. Thanks.